point. I alluded to this earlier. I have noticed over the years of having dealt with members of my gym that have gone to the physical therapist that have come back, and me quiz them about the money they wasted and the time they wasted at the physical therapist's office. And so what did they do? Well, there's about 5 protocols they do every day. You ice, you hot wax, you flexibility stuff. They rub on your hand. They pet you on the head. They do 3 or 4 other things, and then they send you home. And my next question is how did that change over the 4 weeks that you went to the outpatient physical therapist office?
It's the same thing 3 times a week for 4 weeks.
It's the same thing 3 times a week for 4 weeks. So here's the situation. When we train people, we base our training on the stress recovery adaptation model. And it has been my observation that physical therapists are not taught the stress recovery adaptation model. What they're taught is that if they're taught anything at all, they're taught that here's the origin, here's the insertion of this muscle belly, and this is what this muscle belly does, and that's why we do this, except I don't have rotator cuffs on that side. That's external rotator stuff, so we got to do this with bands. If your rotator cuff's injured, this is what we do with bands.
Because we're going to strengthen it, right?
Because we're going to strengthen it, even though that's not what it really does. That's what it does in the physical therapist's office, but that's not what it actually does. So, but the overall observation I have had is that physical therapy regards the original injury as the stress. And they regard everything they're doing in the office as facilitating recovery and adaptation. When the truth of the matter is that if the physical therapist is not applying a stress to the injured system, that the injured system must recover from the stress of the therapy and adapt. And I think that's the whole problem here, because that paradigm is not taught in school. I've asked about it a whole bunch. And if you're not, stress recovery adaptation is a short-term process that takes place over several days, right? If the original stress was the car wreck that happened 2 months ago, recovery's already taking place. And your job as the therapist is to find the weakness in the injured system, apply a stress to that weakness, and have a progressively increase in an incremental fashion, just like training, every time you go in, so that recovery takes place in a progressive manner and adaptation takes place in a progressive manner. And this is the whole in outpatient physical therapy.
Yeah, I think I was probably in my first year postgraduate, and we had in the clinic that I worked at, we had protocols for these things. Basically, it's like an exercise flow sheet for the physical therapy assistants, and that those were already pre-populated. And so if somebody came in with patellofemoral pain syndrome, then here's the flow sheet that you attach to your notes so that they can treat them. And it was a whole bunch of TheraBand, like hip abduction strengthening and stuff like that. And I remember doing mini squats and like stuff like that. And I started out and I was kind of like doing what we're supposed to do, because at that point you're just trying to keep your head above water.
Right, sure.
And as I was doing this, I was like, wait a second, like why are we doing hip abduction and why are we doing mini squats? Why can't we just combine all of these exercises into one exercise that I could progressively load? And so I just started doing that. So my patients started squatting, they started deadlifting, and I remember people looked on in horror that I had people doing these types of things, because no, you're supposed to do hip abduction strengthening. And whenever I asked the question, okay, so this person is 25 years old they've never had knee pain before until they started running three days a week to get ready to run a 5K. Now they've got some knee pain. Tell me, in that chain of events, when their hip abductors got weak.
Got weak, right.
And nobody could ever answer that for me. And even worse, whenever people would say, well, it's their knee hurts because their hip flexors are tight. When did their hip flexors become tight? Because there was no change to the tissue other than it was the loading scheme that they were doing.
Their hip flexors.
And then what I found in our population is that it wasn't necessarily, we always diagnose things as overuse injuries, but it wasn't very long into my clinical practice that I'm like, this guy that comes in that's 60 pounds overweight, like he's not overdoing it, right? He's not. He hasn't been training too hard for too long and doing too much.
He's not overtraining.
No, and what I found was that a lot of times it was because we have biannual physical fitness test requirements, right? That you take a physical fitness test in April and you take one 6 months later in October, that people would do nothing for 5.5 months. And then they would try to like cram all of their training in to pass their PT test
and inflame something.
And so what I did was I just kind of coined the term detraining injuries.
Right.
Or disuse injuries.
And, right.
And everybody around me actually like listened to that. I'd given in-service on it, and they're like, "Oh my God, that actually sounds
that's actually logical.
That sounds logical." And then I'd not argue with people, but I'd ask the question like, "Explain to me how a tight hip flexor, one, tell me how you're going to test it. Number two, tell me the genesis of how that became a problem and how it wasn't a problem for the past 26 years, but now it is."
Now it is.
And
number three, how is that tight hip flexor causing pain a meter? Well, not a meter, but 18 inches distal to that injury.
But this is what I came the realization that I came to is that if you go to a spine surgeon and you have back pain, what do they have to offer you for your pain? Well, they have
spine surgery.
They have spine surgery. You go to an orthopedic surgeon, what do they have to offer you? They've got orthopedic surgery. Yeah, they've got orthopedic surgery. You go to a physical therapist and you have knee pain, what did they have to offer you? Well, they were taught stretches for the hip, so that's what they have to offer you.
Right.
And whenever I got to that point where I was like, wait, the reason why they're doing this is just because this is what they were taught to treat with, that they weren't taught how to.
Their approach is partitioned artificially.
Absolutely, and it's the education process that does that. So then I started getting, by that time I started having therapists work underneath me, and so I started making my clinic look more like what I would want treatment if I went to a physical therapy clinic. So whenever I was out in California, we had 3 squat racks, we had a deadlift platform, we had competition bench, we had monolift attachments, and we set it up almost like it was a sports training facility, and everybody loved it. Then I went to Washington, and we started doing a lot of our rehab stuff in the gym. That I would take people, because I was working by myself, instead of having people go to the physical therapy clinic and do stuff, I would section time out at the gym where people would come in for rehab, and I would just coach them in the gym. And guess what? People got better.